the mechanism of action are known as referred to as a bicycle conjugate, and it's a bicycle because there is the payload is MMAE, which which is the use of many payloads, for example, in fortimab vedotin, but it has a linker that is basically combines both a tumor targeting via a specific antigen and a release of the MME through the linker. Basically, a larger payload is given because of the molecular concepts of the affinity and the selectivity of this particular linker. It's a little bit more complicated. It's a lot more complicated than I'm describing it, but it has these sort of two-prong effect on both the tumor and on the T cells. So it's ubiquitously expressed. It's a Nectin-4 target, much like we see with EV, which is overexpressed. So I found that to be, very important. So earlier phase studies demonstrated, efficacy with objective response rates that showed durability, and so we're now doing the Duravelo-2 study. We were proud to be the first site to enroll a patient. It's enrolling very nicely now in locally advanced or metastatic urothelial cancer patients. And so there's two cohorts in the study. Those who've been previously untreated and those treated, and they basically have varying cycles of receiving the treatment regimen of this bicycle derived antibody drug conjugate. It goes by BT8009. We're looking at different doses, 5 versus 6 milligram per meter square. And we've just had, we've enrolled our first patient, and we're excited. We're excited to see the response rates.